Deadly health emergency is unfolding in the heart of Africa. In the Democratic Republic of Congo, Ebola is spreading at an alarming speed, and health authorities are warning that the outbreak is growing faster than containment efforts can keep up. What began as a localized outbreak has now developed into one of the largest Ebola epidemics ever recorded. As of early August 2026, nearly 3,800 confirmed cases have been recorded, with more than 1,700 deaths reported. And the numbers are still rising. The outbreak has now become the second largest Ebola outbreak in history, surpassed only by the devastating West Africa epidemic of 2014 to 2016, which affected Guinea, Liberia, and Sierra Leone. The outbreak is being driven by the Bundibugyo species of Ebola virus, a strain that presents a particularly difficult challenge for health authorities because the vaccines and treatments developed for the more common Zaire strain cannot simply be assumed to provide the same protection. The outbreak is concentrated mainly in eastern Congo, particularly Ituri province, but infections have also been reported in other provinces. According to the World Health Organization, by July 15, cases had already been reported across 46 health zones in 5 provinces. Why is it spreading so fast? One of the biggest concerns is that the virus is no longer being detected only through known chains of transmission. Health officials say a large proportion of new infections are occurring within communities, meaning people are becoming infected without being identified beforehand as contact of known Ebola patients. That makes traditional contact tracing increasingly difficult. And there is another major obstacle: conflict. Eastern Congo has suffered years of armed violence and displacement. Insecurity makes it extremely difficult for health workers to reach some communities, investigate suspected cases, trace contacts, and deliver medical assistance. At the same time, mistrust, weak health infrastructure, and shortages of healthcare workers are making the response even more difficult. Behind every statistic is a human being. Families are losing loved ones, communities are living with fear, and healthcare workers themselves are being placed on the front line of the crisis. The consequences also go beyond Ebola itself. When an outbreak overwhelms health facilities, routine health care, including maternal services, childhood vaccinations, and treatment for other diseases, can also be disrupted. And this is not yet only a Congolese problem. The outbreak has already raised concerns across Central and East Africa because of population movement and cross-border travel. Uganda has been involved in the regional response, while health authorities across the continent are strengthening surveillance and preparedness. The WHO and Africa's CDC launched a continental preparedness and response plan earlier in the outbreak, calling for hundreds of millions of dollars to support countries facing the threat. World Health Organization. The Ebola crisis in the Democratic Republic of Congo is a reminder that infectious diseases do not respect borders. When dictation is delayed, when communities cannot be reached, when healthcare systems are weakened, and when conflict prevents health workers from doing their jobs, the consequences can become devastating. The priority now is clear: find cases early, protect healthcare workers, reach affected communities, strengthen surveillance, and stop transmission before this outbreak grows even further. For Africa and the wider world, the message is simple: an outbreak anywhere can become a threat everywhere. This is not just a story about numbers, it is a race against time. For more verified international news, health updates, and in-depth reports, stay connected with Common Talk African Podcast News. This is your podcast, bringing you the story behind the headlines.